So if a patient has glaucoma and it goes undiagnosed, or the patient is not taking treatment, slowly and steadily the optic nerve begins to get damaged, and that causes a permanent visual deterioration in the eye, ranging from anything from 6/60 to even perception of light negative. And this vision cannot be recovered even if the pressure later on is controlled by medication or surgery. So most patients usually do not come to us with any symptom. What we do is that every patient above the age of 40 years or patients with family history of glaucoma, we always check the intraocular pressure in that patients, we always check the disc, and if we find a suspicion in both of these, then we go for certain specific tests to diagnose and then treat glaucoma.